Listen to my flow, it's about your life. Words for your children, husband or wife. The increasing population of diabetes I see. The increasing need for people to be on a dialysis machine. Just like a popular fad, one needs to make reservations. They are so full, new clinics send out invitations. Now blacks and Mexicans are in diabetes, TV magazine ads.
Just like we went through your normal anatomy from head to toe, now I'm going to go through the diseases from head to toe so that once again you realize the value of your body. The pituitary gland, I mentioned to you the various hormones. What happens is that during childbirth, there's a disease called Sheehan's disease. So if you should happen to hemorrhage or lose a lot of blood and your blood pressure should drop very low, then that part of your brain will not get any blood supply. The next disease is diabetes insipidus. What happens is you are urinating too much. Again, the pituitary organ cannot produce ADH. And with the mouth, I want you to realize that is also very important, especially when it comes to nutrition. So it's important that you keep up your dental hygiene. It is important that you eat nutritionally, and some of us even use it for sex. And I want you to be aware that there is a higher incidence of young teenagers, young women having oral cancers. That is cancers in their mouth and their throat, due mostly to HPV. You need to be very careful of what sexual organs you are placing in your mouth because you do not want to be at risk of cancer later on in life. Breasts. We discussed the importance of their function. Unfortunately, these can have mass or lumps in them, which can turn to cancer. It's very important that you learn to check your breasts at least once a month. And the sad part about when they become cancerous, some of the medications that we use to treat the cancer in the breast can affect the kidneys. Vagina. Yes, that's also, unfortunately, a source of lots of sexually transmitted diseases. Unfortunately, some of these sexually transmitted diseases can also lead to kidney failure. HIV, syphilis, even hepatitis B or C, which are obtained through sex, and this can affect your kidneys, in which I will have to dialyze you. The kidney. So if you have a heart attack, that actually means the arteries in your heart are not able to give blood to the muscles in your heart. So there's no blood flow. That's pain, no blood flow to the kidneys, and this can lead to kidney failure. Congestive heart failure. You probably heard that term before. So congestive heart failure is when that heart is not able to pump blood to the rest of the organs in your body. Blood gets backed up into your lungs, so now they're full of fluid. You cannot hardly breathe. You feel like you're drowning in your own fluid, and this is called congestive heart failure. This too can lead to kidney failure because there's diminished blood flow to the kidneys. Pregnancy, unfortunately, can also affect the kidneys. We discussed how the pregnancy or the womb fills up with more water and more blood. Unfortunately, there's even diseases during pregnancy, like lupus or Wagner's or sexually transmitted diseases that can affect this womb and can also lead to kidney failure. Ureters. The ureters are the tubes that come from the kidneys, both right and left, and they go down to your bladder. If they get blocked up with kidney stones, which can also occur during pregnancy because the uterus or that womb is pressing up on that ureter, this can stop urine flow and again lead to some urine or kidney failure. The bladder. There's stones that can form from the kidneys and go down to the bladder, and it can cause a blockage. It's called the ureter bladder junction. That is the ureter, which comes down to the bladder, that can be obstructed from a stone, and that can lead to kidney failure. In fact, it's called obstructive nephropathy. No urine is able to come out. You can also have polyps or cancers in your bladder. In fact, cigarette smoke, tobacco smoking is a risk of causing bladder cancer. And lastly, I want you to realize that with multiple births, you can also have incontinence, meaning that you can lose the control of your urine. And when you laugh or cry, you can sometimes leak out. So don't forget that after your childbirth or babies, make sure you do Kegel exercises, which are exercises of the vagina and the pubic coccyx muscles to keep them strong. I want you to know the difference between a nephrologist, a urologist, or an OBGYN doctor, because you may see one or all three at some point in your life. Nephrologist is me. I just explained to you. I specialize with kidney disease, hypertension, and place people on dialysis. I essentially deal with medications. Now, the OB doctor, most of you may be familiar with, they're the ones that deliver your baby. But the urologist is the person that may have to operate on your bladder if there's filled with a tumor, or remove the kidney stone. And sometimes the urologist and the OB/GYN doctors work together in surgery. The GYN doctor understands just deals strictly with diseases that do not involve anything that has to do with childbirth. So if you have any vaginal discharges, lesions, again, trouble with incontinence of your urine, meaning you leak in urine when you laugh or cough, either your GYN doctor and the urologist will work together to try to help find a solution for you. Now, how the kidney functions. Basically, the kidneys are a collection of nephrons, like my name, nephrology. One nephron has a renal artery and a tubule, and you have about 1 million nephrons in each kidney. You can live with just one kidney. Some people donate a kidney to a loved one. If you received a kidney transplant, which usually is in this lower area called the anterior quadrant, you can actually have 3 kidneys. If you were transplanted twice, one on the right side, one on the left side, you actually can have 4 kidneys, but you only need 1 kidney to live with. The kidney is located to T11 to L3, which are really the lower aspects of your spine, close to your tailbone. The kidneys have essentially 5 important functions. One is that it produces water. We all know that, urine. It also balances or regulates your minerals, your sodium, your potassium, your chloride. The kidney also eliminates toxins. Therefore, it cleans your blood. And toxins are like metabolic waste, so products from medications that you take, products from your skeletal muscle, which is called creatine, products from the enzymes that make up your chromosomes called nucleic acids. So what I mean toxins or waste, I'm talking about metabolic waste. Pesticides, hormones, these are the type of things that the kidney eliminates. The third thing the kidney does, it participates in the formation of vitamin D. It makes a protein that activates vitamin D. So now vitamin D can absorb the calcium from your diet in your stomach. It also produces a chemical called erythropoietin. Erythropoietin goes into your bone marrow and helps produce red blood cells. That's important because with low red blood cells, you will have anemia. Red blood cells carry oxygen to various parts of your body. So if you're not making enough of these red blood cells, you are not carrying enough oxygen to various parts of your body, you're going to feel fatigued, short of breath. It also makes a chemical called renin, which controls your blood pressure. And yes, just because you're making urine does not mean that your kidney is working 100%, and I am talking about both of your kidneys.
MIB fib, no TikTok, no flow, arteries block. In the bedroom, can't hit it, cause your thing just flop. Listen to my flow, it's about your life. Words for your children, husband or wife.